To minimize the spread of COVID-19, public health workers need to know about exposures to make sure that all Kentuckians are safe and supported. We are using Kentucky's contact tracing and tracking system to help our disease investigators and contact tracers to gather the necessary information. Let us take the example of Sarah Smith, who is a disease investigator who starts her day by looking at a list of cases to act on. These cases are individuals who have tested positive for COVID-19. She picks up the case of Bobby Rim. Sarah reviews details about Bobby. She calls Bobby and begins the initial investigation. The system provides call scripts so disease investigators can be consistent with their messaging and make sure they do not miss any important information. Sarah confirms Bobby's symptoms, understands his needs around food, housing, and childcare, and finally, Sarah helps Bobby retrace his steps to document who he may have come in close contact with and which public settings he may have gone to while he was infectious. Among those people is Jan Johnson, who is Bobby's coworker. Once the call is complete, Bobby is directed to isolate since he is positive for COVID-19. To assist Bobby in recovery, the system automatically sends an email with helpful information. Sarah follows up with Bobby daily to make sure Bobby is okay and address his needs if they have changed. Once Bobby recovers or is no longer infectious, the case for Bobby Rim is closed. Once investigation is complete, the information is handed off to a contact tracer. Contact tracers are public health workers. Contact tracers such as Fred notify individuals who may have come in contact with Bobby, such as Jan Johnson, who works with Bobby. Fred calls Jan and notifies her of potential exposure to a COVID-19 patient. Fred is provided a call script to assist in gathering information he needs from Jan. Fred confirms demographic information, asks Jan if she has been having any symptoms, and gathers basic medical history. Based on Jan's responses, the system sends a tailored email to Jan with helpful information. Fred follows up with Jan daily to check on her symptoms and understand her evolving needs for support should she start noticing symptoms. After Jan's exposure timeline has expired and she hasn't encountered any symptoms, she gets an automated return to work email. To protect patients' confidentiality, case contacts will not be told the identity of the person who may have reported them. They will be told what they need to do to care for themselves, reduce the risk to others, and protect their communities from any further exposure. Contact tracing and tracking combines public participation and the power of technology to help public health officials and private healthcare providers contain the spread of COVID-19.